I've stuck slides, apologies. All right, for those of you who are new to these webinars, they take place on the second Tuesday, or third Tuesday in this case, of every other month at 11 a.m. with the next date for your calendar being the 11th of July. And these webinars are really designed to include a diverse mixture of research talks and fireside chats aimed at members of the HDR UK community. And this includes those from the national priorities of substantial sites, the hubs, the Alliance, fellows, PhD students, public and patient groups, and more. These webinars are also open to the wider health data science community, as well as the public. And given that the purpose of these webinars is to really help build the One Institute ethos, despite our really distributed setup, we want this to really be as two-way and interactive as possible. So I'd like to encourage you all to please use the Q&A function should you have any questions. And in today's case, we've left lots of time at the end for discussion, so please do take advantage of that. And with that, my name is Holly Dawn. I'm your host for today. I'm the research manager here at HDR UK. And today's webinar is particularly special or a bit different. It's our quinquennial review takeover. And so today we're joined by Alice Turnbull, who is the QQR program director, as well as you may know her from the Better Care National Priority. And Alice is going to kick us off by presenting the current QQR vision alongside the process and what to expect next. Alice will then be joined by Roz Walker, who's our Chief Science Strategy Officer here in the central team, to answer all of your questions and have a more general discussion about QQR. And so without further ado, I'd like to hand the baton over to Alice, who will walk us through our current QQR thinking and vision.
Thanks, Holly, and thank you to you all for joining today. It's great to see so many of you on the call, and this really is an opportunity for you to ask sort of any questions on our evolving thinking and highlighting that this is very much sort of in progress and in development, so really welcoming your feedback. So I'm just going to share my screen and let's get this full screen. Okay, hopefully you can all see it. So first is the sort of $1,000,000 question: what do all of these organizations have in common? So we've got the LMB, MRC Biostatistics Unit, and the Wellcome Sanger Institute, and the CRIC. And the answer for all of those of you who are on the board this morning is that they all are set up by their funders through a quinquennial review process, whereby they are commissioned and given funds for 5 years to deliver their vision and strategy, and then reevaluate their ongoing sort of vision and proposal for the next quinquennium to secure future funding. So that's the process that we're going through as HDR UK at the moment. So we were set up back in April 2018 by a group of 10 core funders, really with the vision that we would be the National Institute for Health Data Research, that would be sort of a preeminent UK-wide organisation leading this field for the next 20 to 30 years. And we were funded in these 5-year periods. So our first quinquennium was April 2018 and will end on the end of March 2023. So our core funders have now kicked off our QQR or quinquennial review process, and we are reviewing we have to share with them our progress and impacts from our first quinquennium, 2018 to 2023, and our vision and proposal for our second quinquennium, so April 2023 through to March 2028. So when we were formed back in 2018, we were established with the mission to unite the UK's health data to enable discoveries that improve people's lives. And we set out at that stage a 20-year vision for large-scale data and advanced analytics to benefit every patient interaction, clinical trial, biomedical discovery, and enhance public health. And as we work on our sort of proposal for our second quinquennium, that really still stands and is at the heart of what what we're all doing, and I know that we're all passionate about. So in QQ1, we specifically set out to enable data-enabled research on the whole UK population, up to 66 million. And we're on track, even though we're sort of, all of this process, I should caveat, is happening 3.5 years into our first quinquennium. But we've been well recognised through that, through our establishment review, which was held last year, and through sort of widespread recognition of leaders across the health data and research field. And really sort of speaking to our stakeholders, key partners across the ecosystem, and members of our community, including many of yourselves, we've really shown how important our role is in convening the infrastructure services. And these are just a few of our quotes from sort of our recent stakeholder interviews that we've been conducting over the past few months. But also then the groundbreaking research to use those infrastructure services, both to deliver impact and drive their development to address new unmet needs. And we really see this as a great opportunity to enable greater impact through this sort of discovery through to research and insight by enabling greater connectivity across the field. At the moment, there's very much a one-to-one relationship between a data custodian and a researcher, but as we move forwards into sort of a sector maturity and the massive growth of the field, there's an opportunity still to maintain that trust and security and transparency, but establish a many-to-many relationship between data custodians, researchers, and innovators in the framework of a sort of fair data ecosystem. So QQ1 has already shown that the power of this approach, where we have this sort of cross-sector running from infrastructure all the way through to research and insight. So an example here is of the Zoe symptom study app, whereby we worked with the Zoe team to build the UK, or take the UK data foundations, enable them to be accessible, in this case through the SAIL data bank, to be discoverable, so available to researchers across the UK through the gateway, and then really bringing in the expertise from across the HDR UK community and more widely to analyse that data, for example, through the Breathe Hub, to deliver insights and impact. So our sort of proposal for QQ2 really builds on this principle of connectivity, but also being guided by these 3 kind of cross-cutting themes or priorities. One is that we sort of stand on the shoulders of giants. We'll get a lot further by building on the amazing science and clinical infrastructure and expertise that are across the UK. Secondly is that the sort of use and connectivity and team science of our UK-wide institution is a unique attribute, and really will achieve better science and greater impact through this approach. And finally, that trust and transparency is absolutely paramount, together with that sort of continual focus on patient and public benefit to ensure that we're really enabling the system to work in the best way to improve people's lives. So this is then moving on to our current working framework for QQ2 in a bit more detail. As I caveated at the start, this is all in development, so very much welcome any feedback, questions on this proposal. So our strategy in QQ2 would remain the same as QQ1, but we really see it sort of evolving to have the 3 domains of uniting data, bringing together UK-wide health data research, using data or making useful data. So using the data to advance science through the high impact research programs that can deliver impact. And finally, the FAIR data foundations, so those underlying infrastructure services that make a secure and trustworthy data accessible to many people. And around that, you can see we're really prioritizing both our users, the users of data, the public, patients and practitioners, and maintaining that public trust. And finally, our sort of one institute and UK-wide coverage, together with our values of transparency, optimism, research, courage, and humility. So this is going into a bit more detail to sort of map specific activities onto each of those domains. So you see, first of all, under the United data, we're talking about sort of local regional networks, which enable participation and knowledge sharing across the different geographies of the UK. Really enable us to work with local data, local partnerships and communities of practice across the UK, and identifying opportunities to bring in leveraged programs which can build on our core HDR UK proposition. Then you've got the useful data. So this is, we've been talking about demonstrator programs, and I'll go into them in a bit more detail in the next slide, but these demonstrator programs are really about generating new UK-wide data foundations which link healthcare data with genetic, environmental, other non-health data, and use this data to enable novel research insight. And finally, the FAIR data services, or the infrastructure services, which enable that trustworthy, fair access to data in a user-centered way, which responds to the demonstrator needs and the wider research community. And all of that supported by sort of one institute leadership, central communications, finance, etc. So going into those different areas in a little more detail, first of all was the United data. So continue to build on our UK-wide community across the different research locations, the hubs and the training locations that we've established in QQ1. And these are just a sort of quick summary of the UK leads across those different regions. The regions really reflecting the original geographies that we set up in QQ1 and building on those communities that have already been established. Then we're thinking in a bit more detail about the FAIR data infrastructure, so the second arrow, which is really designed to meet the needs of researchers, innovators, the demonstrator programs who want to access timely, useful data. And we have sort of these 6, I suppose, work streams along that. First of all is making the data findable. So that's through things like phenomics and the prognostic atlas, which allows discovery of useful data. Then is making data accessible through trustworthy and transparent mechanisms according to the 5 SAFEs framework. So that also includes citizen engagement, governance, ethics, and trust. Then we're talking about interoperable data, so data standards, and therefore using those sort of standardized data sets to enable federated analytics. And finally, reusable data, so developing the talent and training to enable the use of data, allowing data to be used for clinical trials, and also drawing on the hubs network and their data curation activities. And all of that is really then plugged into the gateway to make this sort of FAIR infrastructure service accessible to users, and supported by the Alliance, which brings together collaboration across data custodians to enable this process. So just to sort of building on this, I won't dwell on this side, but the number of organisations currently members of the Alliance. And then this one just reiterating the role of the Gateway in terms of providing a portal to discover and request access to the UK-wide health data research resources, which are otherwise incredibly fragmented. So in terms of the infrastructure conveners, this is again just a sort of summary of some of those different activities that I listed above in the FAIR slide, and the different UK-wide leaders that we have for those services. And then finally, the making useful or using data is the UK-wide research demonstrator programs. So we have identified 6 demonstrator programs, which cut across key areas where there's really an unmet need for a UK-wide data foundation, whether that be sort of linking health and non-healthcare data or making data more usable. And these programs are really set up to address these 6 areas and enable sort of creating the data foundations and then enabling useful research to deliver impact. And here again is just a brief summary of the conveners of the different demonstrator programs that we've who are working together to bring these proposals together. And really the idea is that these different activities will be all connected in together, that the infrastructure services will enable the demonstrator programs, and in turn the demonstrator programs will demonstrate and drive the core infrastructure services, and that all of this will be enabled by the united UK-wide partnerships. And that through this approach will help us to enable a step change impact from QQ1 to QQ2. So building on our existing activities, but really delivering greater impact. And finally, this sort of all of these proposals and all of this vision for that we've been discussing so far is our proposal for the core funds. So our quinquennial review is focused on how we will use our core funds, but a massive amount of the activities and the impacts that we've delivered as an organisation throughout the last few years have been enabled by leveraged funding that really plugs into the core and helps to further develop those that infrastructure. And so looking across those different demonstrator programs, we're seeing quite a few sort of these 3, I suppose, key themes that we'd really like to see as priorities for areas for us to unite what we're doing and really identify opportunities for further leveraged investment. So that's where we are at the moment. Just to sort of reiterate that this is the quinquennial review is quite a lengthy process, and the second quinquennium doesn't start till the 1st of April 2023. At the moment, we're working towards our board reviewing our draft report proposal in December. That in January, we'll then be taking the feedback from our board and finalising the report, which then needs to be submitted to our core funders at the beginning of February. Then throughout spring next year, the core funders have commissioned an international peer review process, which is followed by review committees who conduct site visits covering the sort of different activities that we're proposing for QQ2. The international peer review and the review committees then feed back to the core funders who make their final decisions about budget allocations and what are our sort of future strategy in the winter of next year. And then finally, we're lined up to start in April next year. So although there's, or April 2023, sorry. So although this is a sort of a lot of activity going on now, this is a longer term process that we're going to be working through for the next 18 months. So as I said, this is a work in progress, and very much appreciate your feedback. And we're also very keen for you all to feel able to get involved and participate in helping us really shape this vision and deliver in QQ2. So please do reach out to any of those infrastructure, regional or demonstrator leads. They're all very keen to work with you to identify opportunities to work together. All the details are on the quinquennial review page of our website. The link is here, but it should also be in the main drop down on the website. All of the different demonstrator programs are convening workshops. So the next ones over the next couple of weeks are the pandemics and outbreaks, which has a workshop scheduled on the 18th of November, and then big data for common complex diseases, which is on the 19th of November. And then we have a Frontiers meeting next Monday in the afternoon, and would really welcome you to join that meeting. We'll be having presentations from the different demonstrator and infrastructure leads, and really an opportunity for discussion about the vision and and any feedback from you. So going to stop there and hand back to Holly and open the floor for any questions, I believe.
Lovely. Thanks, Alice. It's quite the whirlwind tour, and it's great to see how everything's starting connecting, especially with the demonstrator programs and the infrastructure services and their interplay. So we're going to open it up to questions now. I'd like to encourage everyone to use the Q&A function. We already have a few in there. So I'll start with a question on what feedback have we received from the funders so far?
Should I take that one, Alice? Thank you for giving the nice overview. So we actually met with our 10 core funders last Friday, just to give them a kind of like an interim update of where the thinking had got so far. They were all very, very positive and constructive, and the conversation was very much about helping us to put our best foot forward, as opposed to kind of telling us that we were going in completely the wrong direction. So that's reassuring at this late stage before the submission. I think they really wanted us to bring out the so what from quinquennial 1, making sure that we didn't assume any knowledge about the massive strides that had been made, and using kind of I guess more illustrative model like case studies rather than just kind of bland facts and figures, although both are important. And as ever, we've got Melissa on the line, lovely Melissa Lewis Brown, who's, I should say, congratulations, has left HDR UK for those that don't know, and doing an exciting role at Cancer Research UK at the moment. But attribution, Melissa, your favourite topic, came up, and us being very clear in the quinquennial report, and actually that's quite important, because what's been assessed through this process is just our core funds, and HDR has been very successful at working with our partners and the community to leverage lots of additional programs, particularly through COVID. And they really want us to focus on making sure that we're clear about what's happened to use of the original core funds, not the wider world, although obviously that is important context. They also very much welcomed our focus on infrastructure, as opposed to just delivering research that any other organisation could deliver. So really thinking about what, as an institute and a national institute, we can be uniquely capable of. And really, again, welcoming kind of the diversity of the different approaches we're using in that, but also kind of coming back to things like training. How are we clear about the difference between very deep training experiences, such as students and fellows, versus some of the broader activities that we do to kind of democratize health data science, so that we're making health data science more widely available to others, for example, through the Black Internship Programme that we delivered. So lots of great snippets, but I think we're positive and heading in the right direction, although, as Alice said, there's a long way to go. And we'll see what the international peer reviewers have to say next year as well.
Thanks, Roz. And a question from Melissa. Can you say any more about the demonstrator program on common diseases?
Alice, should I have a go? Do you want to take that one?
Yeah, no, you can kick us off and I can always add anything in.
Great. So I guess the short answer, Melissa, is join the next working session with Kathy and Mark, which Alice put out. really, for me, what that program is about is very much trying to kind of take a step beyond what's been achieved, particularly with the BHF Data Science Centre and the use of the big national NHS digital data sets, and really go beyond individual diseases to start looking at common mechanisms across diseases. So they are, starting with the big ones, cancer and cardiovascular disease, but also have a focus on kind of, I guess, diseases of the aging. So, eventually reaching out into dementia and other things. So what we want to show is the proof of principle that you don't have to use data for its kind of original kind of clinical deep domain purpose, but you can use these big population data sets to start asking questions across different diseases to look at outcomes and how you can improve outcomes for a wide range of patients. So that's my top level understanding, but as I said, it's still a work in progress, so I'm sure you'll learn more at the workshop.
And yeah, only just to add on to that is really making use of those national data sets to understand how we can reduce health inequalities and ensuring that the needs of underserved populations are also met. So that's another kind of key focus for that programme.
Thank you both. Another question is, how does the QQR fit into other work that HDR UK is doing, such as the international side with ICODA, as well as the data and connectivity programs, for example?
Yeah, so I'll steal a quote from Caroline Cake, actually. So our chief exec, and the way she actually described this to the funders last week was very much about the core creating almost kind of like the Lego tower, but with the bricks all facing outwards, so that you can dock on as much as we possibly can in QQ2, so that we continue to grow both in terms of the infrastructure services and then the potential research uses of this infrastructure. So the core very much is about kind of the minimal viable product of what we need to kind of have that long-term 30-year vision for the core funders want us to achieve, but very much designed to only be a core and for other things to augment that over time. So that includes, like you say, existing programs, be that ICODA, which has the international COVID flavour, the data and connectivity programme obviously going on at the moment with that COVID flavour, as well as something else if people aren't already aware of, which is the DARE programme, Data for Analytics and Research Environments, I think. So we're working with partners, the Administrative Data Research UK and also with UKRI, to really think about what the trusted research environment infrastructure needs to be, that we can't do all of this lovely work to make data discoverable if there's no way to actually store and analyze and link the data. So that's obviously a separate but a key part of kind of the future as well. So very much designing things to build rather than designing this to be everything in the center.
Thanks, Roz. And sort of backtracking a bit, you mentioned in response to Melissa's questions about the demonstrator programs and the workshop that they're holding. How would people get involved in the other side of this, which is the infrastructure services?
Yep. So good question, and I'll pass over to Alice, but the short answer is that they will also be holding workshops in due course. The work in the infrastructure has been a bit more complex. There's lots of moving parts, and we've taken a little bit more time to agree kind of the overarching operating model. But that the slide Alice showed is I think now, sticky, it's staying. So based on that, we're going to start organizing some workshops around that model and very much welcome people to input into that.
Absolutely. And just to reiterate Roz's view, I think that, or Roz's points, that one is that they have been a bit further behind because in part they've been responding to the needs of the demonstrator program. So it's important to understand their needs as well as the wider research community. But also just to reiterate that as those workshops are organised, they'll go on the QQR page of the website as well, and we'll be sending out community mailing lists just to let you know. So please do look out for that.
Thank you. I'd like to put in a last call for questions. It seems we've dried up a bit. If anyone has any further questions, please do pop them in the Q&A. Doesn't appear that anyone's frantically typing. So with that, I'd say thank you to both.
Sorry, hold on. I think I'm not sure we've covered Melissa's one about environmental sustainability, her second question.
Yes. So one more question. Can you say any more about the plans for environmental sustainability as part of the QQR, please?
Well, I was tempted not to mention it because it's a tough question, Melissa. so I'll have a stab at it, but again, help me out if you can. So there's I guess there's a number of components. One is that as a central team, obviously, we've got the small core and really, we're trying to think ourselves about how we manage this. It's to be frank, it's a challenge when you're distributed across the UK. It's great to see people face to face now that we can post COVID, but that does mean our travel can rack up. But we're trying to kind of use hybrid meetings and those sort of things as much as possible. There's then obviously, from a research community point of view, I know there's some great work going on, looking at the environmental sustainability of things like genomics and the very, very compute intensive elements of what we do. And then last but not least, I guess as a research question, Alice mentioned a kind of common theme across the programs we've identified is this kind of resilience and health shock side of things. And obviously, climate change has a massive impact on people's health, particularly not so at the moment, I'm sure it will come, unfortunately, in the UK, but also, further afield in the global south. How are we making sure that we're using data to mitigate the impacts of long-term kind of environmental risks? So that's not a complete answer. It's very much a work in progress. So if you can point us in the direction of any useful things for us to think about, Melissa, please do. But that's just my top of the head response at the moment.
And yeah, the only thing that I would add to that is that we have set out sort of milestones for all of our demonstrated programs and infrastructure services. Those milestones are guided around the core principles that we are setting up all the programs on, one of which is that environmental sustainability. So by the first milestone, we'll be working with all the different demonstrator programs and infrastructure services to establish each of their strategies for environmental sustainability and net carbon neutrality eventually. And then really build on them with each of the milestones to drive progress through that. So as Roz says, it's in progress, but we can't give you a confirmed answer, a definite answer at the moment.
Great, thank you both. All right, and with that, there's no final questions. So thank you, Alice, thank you, Roz. As both Alice and Roz mentioned, there's a lot of workshops going on in terms of both the demonstrator programs and the infrastructure services. We'd like to encourage everyone to get involved with those. And I popped a link in the chat for our QQR webpage where you can find all the latest updates, including how to register for those workshops and community events. And with that, I'd like to close out with a very quick summary of a few other events we have going on this week and into early next week that might be of interest to you. So this week we have the BHF Data Science Center's science webinar, which is going to be looking at estimating excess deaths and risk of mortality in chronic kidney disease using data pre-pandemic and comparing that to data during the pandemic. We also have the Gateway Open Door, which is particularly interesting this month. We have recently launched the Data Utility Wizard, and that was built in collaboration with Flatiron Health. And so they're going to be talking about their experiences in doing that. We will also be looking this week at COVID-19 vaccine safety research through the Data and Connectivity Group. And lastly, and closely linked to this, on Monday, we will see the Quinquennial Review's Third Frontiers meetings. We'd like to encourage everyone to register for that. And I will pop a link in the chat for everyone so you can see, again, where to find each of these events. And with that, I'd like to thank everyone for your time. Please do stay involved and stay in touch. And I look forward to seeing you on the 11th of January.